Welcome to the first module of Continuing Education on Feeding Assistance and Nutrition in the Elderly. This module will discuss changes that happen with age and how these changes affect nutrition status. This module will take approximately 20 minutes to complete. After completing this module, you will understand what age and aging are, be familiar with physiological, psychological, and social changes that happen with age, learn how these age-related changes affect nutrition status and health, and understand the importance of good nutrition in the elderly. So what exactly is age and aging? Age is defined as the time something has existed or number of elapsed time units between birth and present time. Every human being has an age. For example, if you were born in the year 1985 and the present year is 2010, your age would be 25. This describes at present the amount of time in years that has gone by since the year you were born. Actual aging itself is a process or group of processes occurring in living organisms that with the passage of time can lead to a loss of adaptability, functional impairment, and eventually death. The process of aging is inevitable and irreversible for all living organisms. The rate at which aging actually occurs greatly differs between each individual person. It significantly depends on disease, environmental factors, behavioral factors, and genetics. It is indefinite that many changes happen with age. Older adults physically look different than younger adults. Their skin begins to show wrinkles more prominently, hair changes to gray or white, and they begin to move slower. As the aging process occurs, changes take place not only physically, but physiologically, psychologically, and socially. Some of these dimensions actually expand and grow with age, such as knowledge of world events or wisdom, while others may decline, such as mobility and sight. We will first begin by discussing physiological changes that happen with age. Physiology is simply the study of body function. With age, changes happen to the way organs, tissues, cells, and other body components function. These changes affect the daily life of older adults. Body composition is the first physiological change we will discuss. Body composition is the physical makeup of the body. The body is composed of two main components, fat and fat-free mass. Fat-free mass, also known as lean body mass, is made up of water, protein, and bone mineral. Fat mass is composed of essential fat that is needed for normal function of the central nervous system and other organs in the body, and storage fat that is stored as adipose tissue. Fat is used as an energy source, insulation, padding, and a storage site for some vitamins. During the younger stages of life, the body is largely composed of fat-free mass. Approximately 61% of the body is made up of water and 19% of protein. As humans age, there are shifts in this composition, leading to the body still being predominantly made of water, but at a lower percentage of 53%, and the second largest component shifts to fat, around 30% instead of protein. Therefore, with age, fat mass increases and fat-free mass decreases. Fat is also shown to progressively redistribute itself with age. Abdominal fat tends to increase, while fat on the limbs tends to decrease. There are approximately 700 skeletal muscles in the human body that enable movement, posture maintenance, control reflexes, and help maintain body temperature. Muscle strength is the measure of the contraction force of the muscle. Strength is needed for many activities of daily living, such as carrying groceries, climbing stairs, getting in and out of cars, and walking. Maximum muscle strength is reached between the ages of 20 and 30 and is shown to steadily decline thereafter. Sarcopenia is the age-related loss of muscle mass. Sarcopenia accounts for a large portion of strength loss in older adults. Changes in muscle fiber characteristics, the nervous system, and muscle blood flow along with decreased physical activity and an increase in disease, all contribute to the loss of muscle strength with aging. Sarcopenia significantly impacts the daily life of older adults by decreasing mobility, increasing the risk for falls, and altering metabolic rates. Hand grip strength is also shown to decrease with age, leading to a decline in the use of hands. This is necessary for activities of daily living, such as grasping a fork, cutting up food, or opening medicine bottles. Fine motor skills are skills of smaller muscle groups, such as those found in the hands. This type of skill is formed early in life and is essential for many activities, such as handwriting or gripping and manipulating objects with the hands, such as eating utensils. These activities show a slowing or a weakness with age. In contrast, gross motor skills are the use of large muscle groups. As seen with fine motor skills, activities such as walking or running are shown to slow with age. Slowing and declines in these motor skills can impact the nutritional status of an individual by making it difficult for them to manipulate eating utensils in the hand, open food containers, and decrease mobility, leading to difficulty carrying out activities such as going to the store. The resting metabolic rate, or RMR, is the energy expended for the maintenance of normal body functions and homeostasis, such as respiration, circulation, and the maintenance of body temperature. This represents the largest portion of total energy expenditure in the human body. The RMR is affected by body composition and is mainly determined by the amount of fat-free mass an individual has. The RMR is highest during times of growth, such as in the first few years of life and adolescence. After growing is finished, in early adulthood, there is a decline of the RMR of 1% to 2% per kilogram of fat-free mass per decade. Resting energy expenditure, also known as the REE, is a measurement of the RMR over 24 hours measured in calories. Therefore, it is the amount of calories needed in 24 hours to stay alive. The REE shows a decline with age due to body composition changes which slowed the RMR. Aging itself is associated with a decrease in energy needs and intake. Energy needs decrease by an estimated 3% per decade of life. These low energy diets may be deficient in many essential nutrients due to the lack of eating enough calories from nutrient-dense foods. The gastrointestinal, or GI tract, also known as the digestive tract, is a muscular tube that extends from the mouth to the rectum. The GI tract is where food and fluids are broken down, digested, absorbed, and finally excreted. The process of digestion begins in the mouth with the chewing of food. It is then swallowed and begins moving through the esophagus, stomach, and small and large intestines through a wave-like motion called peristalsis. The leftover matter that has not been absorbed is then excreted through the rectum as waste. With age, the GI tract goes through many changes that may impact how food is broken down and absorbed. The mouth is the first part of the GI tract. It is adapted for ingesting and preparing food for digestion. The mouth breaks down food into smaller pieces with the teeth and blends with saliva for ease of swallowing. This liquid is necessary for the digesting, moistening, and binding of food particles and coats the teeth in enzymes that help break down food for protection. A decreased production of saliva is seen with age and may lead to significant discomfort, increased risk of dental caries due to the decreased protection of teeth, and alter the taste sensation. Partial or complete tooth loss is common in persons older than 65 years of age and can lead to painful chewing that can have a significant impact on dietary intake. Due to this tooth loss, many elderly also wear dentures to help chew. If dentures do not fit properly, this can cause pain with chewing, altering food intakes. Finally, Jaw muscle activity is severely shown to decrease with age, decreasing the ability to chew. These declines in the ability to chew can lead to food not being broken down adequately, causing larger masses being swallowed than desired, therefore increasing the risk of choking. After food is broken down adequately in the mouth, it is swallowed and moved down the esophagus by peristalsis until it reaches the lower esophageal sphincter, or LES, right above the stomach. The LES is a circular muscle that slowly lets food into the stomach and also prevents backflow of stomach contents into the esophagus. With age, the esophagus stiffens and muscle contractions decrease, causing a slowing down of peristalsis. The LES also becomes less effective with age, leading to a delay of food entry in the stomach, heartburn, and possibly increasing the risk of choking. Once food is moved through the LES, it reaches the stomach where it is mixed with gastric acid that initiates the digestion of protein and provides small amounts of absorption. The inadequate or decreased production of gastric acid in the stomach affects about 30% of those aged 50 years and older. Gastric acid helps break down food and absorb certain nutrients such as vitamin B12. Motility in the stomach is also shown to slow with age. This leads to a delay in the gastric emptying and causes poor digestion. This slowed motility can also cause lower energy intakes due to the lack of hunger from food sitting in the stomach longer. Once food is mixed in the stomach, it is then released into the small intestines where most nutrient absorption happens. Once nutrient absorption is complete in the small intestines, the matter is then moved to the large intestines, also called the colon, where water and electrolytes are absorbed. The food moves through the colon via peristalsis. As aging occurs, atrophy of the colon muscle layers happens, slowing peristalsis and the movement of material through the colon. This decline can cause constipation due to contents moving more slowly through the colon, increasing the amount of fluids absorbed. Constipation may cause a loss of appetite and a feeling of fullness, leading to the decreased intake of food and fluids, possibly affecting the nutrition status of the individual.